You're live at TVC News. Next, the health experts say Nigeria is the capital of the world for sickle cell anemia, and the government and relevant agencies are doing next to nothing about it, putting thousands of children at risk every year. Sarah Ayeku has more on this.
Over 40 million Nigerians are carriers of the sickle cell gene. It is estimated that over 150,000 children are born with sickle cell disease in Nigeria each year, making it the highest number of newborns affected by the condition in any country in the world. From this number, 2/3 of these children do not live to celebrate their 5th birthday. One of the preventive methods suggested by experts is that intending couples know their genotypes before marriage, but sometimes fate, or perhaps human or mechanical errors at a health facility, will throw a spanner in the wheel of destiny, like it did for Mrs. Adetun Bamike and her husband.
We don't even know. After a year, he started have swelling hand. Maybe he fell from school. We don't know. He will be screaming. Before we know that, it's like this boy is suffering pain. He's crying for pain. And we now took him to hospital. It was from the hospital they now diagnosed him as sickle cell.
She tells me caring for a warrior like Elijah could take a toll on the family. Although she is grateful for the Sickle Cell Foundation Nigeria's support in the last 1 year, she hopes to get a child a bone marrow transplant someday.
The number of the time he spent in school is limited, but yet he will be at the top of the class. He's in primary 1. He can read, he can write. There's no novel. He will pick novel up and read, while other child cannot do. So I see him as a warrior. I see him as a special child, a peculiar, a unique child. It's my hope and it's my joy.
An intermittent care needed for the sickle cell warriors is a 15-minute painless scan for children under the age of 16 years. This scan prevents children living with the sickle cell from having a stroke. For the transcranial Doppler scan machine, a special equipment that helps children with sickle cell disorder, is scarce and expensive. To ease the burden of the foundation, the Covenant Medical Group Global Foundation, in conjunction with the Association of Nigerian Physicians in the Americas and the Rotary Club of Lekki Phase 1, donated 4 TCDs.
See these as one area that we need to attend to improve the quality of life for our children and also make a happy home.
They're able to reach out to donors that gave us not just 1, but 4 of these machines. So it's going to go a long way to prevent crisis with the sickle cell children. When we started, the machine was about $16,000 for one. I know by now it should be about 20,000. So with the 4 that have been made available today, that means we're talking about $80,000. So if you convert that to a naira as I did, so we're talking about 80 million. We're talking about minimum of 80 million naira. You know, this is what Rotary is doing.
What we are celebrating today, so to speak, is the fruition of that particular partnership that have existed between Rotary, AMPA, and of course the Society for Sickle Cell.
We envisage that there should be laws, but appropriate laws, the kind of laws that will help the people who have sickle cell disorder. For instance, we want to see that children with sickle cell under the age of 5 are getting treated free.
Health experts are asking the government to draft policies and laws mandating newborns to be tested for sickle cell so that Nigeria can have credible data of the burden of this disorder. Sarah Ayeku, TVC News, Lagos.